Hi, everyone. Welcome back. Today, we are joined by two different doctors, Dr. Adam Hirsch, the professor of pediatric infectious disease at the University of Utah, and Dr. Emily Thorell, associate professor of pediatric infectious disease, also at the University of Utah. Emily is also the director of the antimicrobial stewardship program and the associate hospital epidemiologist at Primary Children's Hospital. Today, we're going to be talking about children and COVID-19 and give an update to the community. Schools are starting in about 3 to 4 weeks, and I wanted to talk to Emily and Adam about their thoughts on everything that's been going on. Thank you both for joining us. I really appreciate it. So our first question for you guys, I want you both to kind of explain your roles and how you've been involved with COVID-19. Emily, let's start with you on that one.
So we started looking at COVID-19 when it was first reported back at the beginning of the year, and started to think, is this really something that's going to affect us? So starting about late February, early March, we started convening some groups at the hospital to try to think about whether this was going to come our way. And then suddenly in mid-March, just like everybody else, we started convening a lot more frequently. So I've been on the kind of COVID task force at Primary Children's Hospital during this whole time as the associate hospital epidemiologist, really working on infection prevention strategies for the hospital, but also for the community and what we could do to support kids in the community. Since that time, lots of things have come up, including school reopening, which is why we're here now. And Adam and I and a couple of our colleagues have been pulled in a little bit on that work, both with the state and with our local communities.
And Adam, what about you?
Hi. Most of my work has been involved in two areas. One, working to develop school reopening policies and consulting with school districts and individual schools about their reopening plans. And the other area where I've been actively involved is in trying to collect data to better understand the epidemiology of this infection in children, particularly in our community.
Well, thank you both for joining us. We'll get right into it. So a lot of school districts are needing to make those decisions about what they're going to be doing by August 1st. That was kind of the deadline that was given by the state. What are some major considerations that schools and districts are working through to make decisions on in-person versus online learning? Adam, do you want to take that one first?
Yes. There are a number of considerations that every school in the United States is working through. Though the details of those considerations may differ, really the nature of those considerations are really kind of the same across the country. First and foremost is what's going on in your local community in terms of the epidemiology of COVID-19, in terms of case numbers, percentage of tests that are positive. And that's quite variable throughout the country. And it tends to be quite variable, potentially even within a state or even a region of a state. Other major considerations are looking inward at the school environment, the built environment of the school, the physical space that's available, the number of students that are, literally down to questions about how far apart can we spread students out within our classrooms. Other really important considerations are the teacher and staff workforce in schools and what their concerns are and what their potential availability is going to be going forward, entering into the fall. Other considerations, of course, also include the local school community of caregivers and students and where they sit in terms of their concerns about returning to school. And again, that's an area of really tremendous variability within communities.
Emily, any additional thoughts on that question as well that Adam didn't touch on?
I think the only additional thought I have is the schools and school districts are really going to need to consider the disparities that may go on in their populations as far as accessibility to online learning. So I think that's something that may be different in different communities, and everyone needs to think about it.
That's a great point to consider too. I know a lot of school districts are doing different things as well. And so it depends on, like you said, where you live, those decisions will kind of vary. One of the biggest questions that we've gotten to about children in COVID-19 is the fact that there's been a couple of news articles and media reportings on the fact that kids are not spreading COVID-19. I want to talk about that and get your opinion on whether that is any truth to it, and if we know anything about the spread from children to an adult. And Emily, let's start with you on that.
Sure. We have a little bit of data to say that maybe children are not spreading COVID-19 as frequently as adults are. It's a little bit limited in the fact that, we did kind of shelter our children early on. And so we don't really know if they are as robust at disseminating this infection as the adult people are, because they really have been at home for the most part. Although there are some instances such as daycares that have been remaining open, things like that, where we really do think that maybe kids don't spread COVID-19 as much as adults do. And there are some physiologic things that may go along with that. We think that COVID-19 or SARS-CoV-2 virus it attaches to a receptor called the ACE2 receptor that we think children have less of in their nose or in their nasopharyngeal cavity. And so there may be a physiologic reason for that too. Ultimately, I don't think we really know exactly what we're dealing with kids here yet, because we haven't exposed them as much as we have adults. However, I do think that it is probably a bit less of a risk from what we know now. That may change.
Adam, anything you'd like to add on that as well?
Yeah, just adding to the point that Emily was making, in our state, we have been looking at the distribution of infections. And again, to the point that Emily just made, children have been circulating in our communities, perhaps less often as adults. But it's really interesting what we've noted, and other parts of the country have noted the same thing, which is that children are accounting for about a third less of cases than you would expect them to account for based on their representation in the population. In some cases, in some settings, they seem to be accounting for even less than a third of the number of cases that you might expect, just based on their sheer numbers of the population. One of the earliest reports from CDC going back a couple of months showed that while children account for nearly 1 in 5 people in this country, they were only responsible for about 2% of infections in the first 6 to 8 weeks of this pandemic. And again, some of that may have had to do with how they move around in our communities, but it seems quite likely that there may be some biology at play as well. And that's great news from the perspective of child health.
We also saw that out in the children's hospital. We really didn't have very many admissions at the beginning. In fact, admissions just dropped like a rock because we didn't have all the other winter respiratory viruses getting spread around with all the kids at home. So that was a really interesting experiment early on.
But just one last point, kind of building on what we were saying, and Emily and I have talked about this quite a bit. The fact that children might be less likely to acquire the infection, and the fact that even if we acknowledge the possibility that they may be less likely to transmit the infection, it doesn't mean that they can't acquire the infection and can't transmit the infection to other children or to adults. So less is better, but less is not zero.
That's a really good point to bring up. I think we've talked about this in other Facebook Lives, that a school does not just contain children. There's other people in the school. There's the teachers themselves, the janitorial staff. So you're not just thinking about the risks that potentially children to children have, but like you said, that child to adult, or even an adult that is potentially infected with SARS-CoV-2 that gives it to a child potentially. And there's been a couple of instances. So someone mentioned that there's been studies about 22 European countries opening back up their schools. A lot of these countries had higher death rates than the US, but they have not seen a significant increase of spikes, cases attributed to those schools. Is there anything that we can learn from those countries that have opened back up schools? Are they doing anything specific? Are masks involved? What do you think the case is with that? And Adam, we'll start with you.
It's a great question. It's perhaps the most important epidemiologic question ever posed on Earth. I think there's quite a bit that we can learn from other countries, but we have to be very cautious in extrapolations, because there are really important contextual differences around the world. the most important consideration is the fact that in most of the countries where schools reopened, whether it was during the spring, late spring, or have reopened throughout the summer, the epidemiologic curve, or the rate of new infections, the percentage of tests that are positive, have been in a rather favorable direction. These were settings by and large where things were going really well. Cases were declining. The number of people that were infected on a given day was declining. And so it was in that context that in many countries, schools were reopened, and in most instances, so far, so good. It's also important to think about, well, what were they doing in the school environment and what mitigation strategies were occurring? And that was actually quite variable. There are some countries where masks were required. There are some countries where masks plus significant space between students was required. There are some countries where only teachers were wearing masks. And there are some countries where it was just business as usual. In general, the more protective or mitigating measures that were in place, the more effective, or the less of an impact there has seemed to be on new infections in children and overall community transmission. But I think the main take-home point is that most of where we're extrapolating data from, i.e. other countries that have already reopened schools, were settings where the epidemiology looked quite a bit different than it does in the United States. Now, the United States is a big country, and there are parts of this country where things are going really well, and there are parts of this country where things are, unfortunately not going so well. So that's really the most important consideration to think about. Taken in isolation, however, I think that it is fair to conclude that holding a lot of other things constant, the act of reopening schools taken in isolation does not appear to be associated with super spreading events or dramatic changes in the epidemiologic curve.
Emily, anything to add to that as well?
I completely agree with Adam. The other thing that we need to consider is that with reopening of schools comes a lot of extracurricular activities such as athletics and that sort of thing. And we really are at a dearth of data. We really don't have very much data to tell us what's safe there. And so we have to kind of extrapolate from some of the other strategies that we've taken to keep people safe. So there may be, variable guidance as far as that goes. The other thing I wanted to point out is there are some really good resources. Colorado Children's has put out a really nice public health kind of statement, or population health statement, I should say, about opening schools. And they kind of take a tiered approach as to what you should do, and then what you could add in layers to make everything safer. So I would point people in that direction. And then Utah Department of Health is actually creating a document for their local health departments to use to aid schools if we were to have problems in the school, such as a teacher or a student being COVID positive, and what to do about that. So there is going to be some resource for us to use when we go forward with opening schools, because it is an area of uncertainty for us.
It's good to hear we won't be going blindly back into it, and that you guys are working to kind of help that out. You brought up extracurricular activities too, and I want to talk about choir, and because that is something that you're projecting more respiratory drops, from what I understand, and there is a higher risk of getting COVID-19 if you did have it. Do you think schools should have those types of classes be in person, or is that something they should maybe consider to hold back on until we figure out if the spread happens in schools or not? Emily, do you want to answer that one?
Sure. Yeah. Unfortunately, choir is probably one of the most dangerous activities that we could have in school. And we really are basing that on a set of data out of a choir that had practice in March, where one member was probably more of a super spreader. Or were they a super spreader, or was it just the fact that they were singing and projecting their voice and their droplets across the whole choir? And correct me if I'm wrong, Adam, but I think it was about 2/3 of the choir that became COVID positive, and they actually had a few deaths. And this was an adult choir, not a children's choir, but that is the one piece of data that we have to go on. So should we do choir? I would say it's very risky. Are there ways to mitigate that? Potentially, but I don't know of any way to make it super safe.
And speaking of that too, I want to quickly touch on masks and the fact that in Utah, it will be required that people or kids and teachers wear masks in schools as well as on school buses. There's been this thought process, though, that what happens when lunch happens or outdoor activities happen, when you're eating or drinking, you take off your mask. Is there a risk to having a ton of people in a lunchroom type situation where all of a sudden no one has a mask on anymore? And we're not protecting ourselves as much. Adam, do you want to take that one?
Sure. I mean, just taking one step back, there is a state policy about use of face coverings at all times during school, and I think every day that kind of goes on, it's more and more clear the benefits of face coverings and reducing and mitigating person-to-person transmission. I think that's becoming, although it remains controversial in some ways, at least from the perspective of the evidence of effectiveness, it's really that the evidence base is very strong. And I think it's also important to acknowledge and just say, we've all, those of us in the healthcare side of things, we've spent a lot of time in masks. Nobody thinks that wearing a mask is comfortable. But what I have observed and heard anecdotally, seen photos of, talked with lots and lots of people throughout the country and locally, especially about younger children, including daycares. Children are so remarkably resilient and resourceful and adaptable. And, it's surprising to me, frankly. But then again, as a pediatrician, maybe not so surprising, just how well some of the youngest children have adapted to using masks as a part of their daily lives. Do they make some mistakes? Do they take it off? Do they scratch their nose? Of course, but we can't expect perfection with mask use. But it seems overwhelmingly that the evidence that transmission is reduced is favorable, and that young kids do seem to be doing really well with masks. You bring up a really important issue, which is we're doing so much work to try to make school environments as safe as possible. In some school environments, we're going to go so far as having very limited in-person attendance 1 or several days a week instead of 5 days a week. That's a major sacrifice. Students are going to be spread out. There's the possibility that really important activities like choir potentially could be temporarily suspended due to concerns about their students are they have already made massive sacrifices, and unfortunately are going to continue to be making massive sacrifices. The point that I'm getting at, though, is it's worrisome to think that you could go to all this trouble only to create a moment or a 15-minute or 30-minute period like lunch when we kind of break it all down and kind of open a window to the possibility of transmission when we spent so much time really protecting and mitigating the risk. There hasn't been a whole lot of evidence developed yet about the risks associated with eating, but it's plausible to imagine that the act of eating, which obviously by its definition involves no mask or no face covering, but it really is plausible to imagine that act, sort of like singing or yelling or speaking loudly, may well expel more respiratory droplets than speaking quietly or not speaking at all. So this is an area of some concern. I think things like, for instance, if a cafeteria setting was continued to be used, and as you all know, that's an area of some discussion, the issue of using a cafeteria versus eating lunch in the classroom versus potentially moving all dining to outdoors, which is a very attractive option, in my opinion, because outdoor interactions are clearly safer than indoor interactions, even when it's chilly. But this needs to be thought about very carefully. And for instance, if our mitigation strategies are face coverings and physical distancing all of a sudden becomes just absolutely paramount in the context of eating lunch when you're not going to have a face covering on. So these are really hard considerations to work through. I don't know that there's a single solution for every school, but I think keeping students, ensuring that they can maintain their distance, that may mean more and more shifts through lunchtime. It may mean bringing lunch into the classroom. But my favorite, of course, as I mentioned before, is thinking about how to move dining to outdoor settings where it might be its safest.
I have a follow-up question to that too. I'm going to ask Emily. And also, I would love the idea of outdoor dining if only it didn't snow so much here. So I'm curious what will happen with the winter with that. But Emily, a follow-up question to the physical distancing and wearing a mask. We've had a couple parents ask us or have some concerns that if their child is in a classroom and everyone is wearing a mask, is physical distancing still necessary, or are schools going to spread people out so that they're wearing a mask, but they're also far apart, and what the benefit of both of those things would be together?
Yeah, as I alluded to earlier, I think a layered approach is actually the best one. So when we think about the most important mitigation strategies, I really think that, face coverings is number one. Social distancing is also very important, especially when face coverings are not in play, so such as time as eating or outdoor activities. Being outdoors is another great one. So, I know we have kind of harsher winters here, but we're also pretty harsh ourselves. A lot of times we're all outdoors in the winter anyway. So, it's all about clothing more than the weather. So those are things to think about. But what's the most important thing? Face covering, I think probably is the most important thing. And other than that, there are some studies that say, do we need 6 feet? If we're in a mask, maybe we don't need 6 feet. There are some places that have done 3 feet plus a mask, and they haven't had any worse outcomes than those with the 6 feet distance. And so I think when we use a layered approach like that, I think it just makes things safer. I wouldn't say that we would take away masks when we have 6 feet, because we do also know that there are those instances when you can project your droplets a little further than that if you have a coughing fit or something like that. And so the face covering is really where it's at.
I'm going to take a few questions that have come through on our Facebook Live just pertaining to masks. One person just asked us that they've heard worries about health risks to children wearing masks for 6 to 7 hours a day versus an adult wearing a mask for that long. Do we have any evidence on the potential effects of a child wearing a mask for a longer period of time? Does that do anything to them? Is it causing any harm? Adam, I'll have you take that one.
No. There's no evidence that masks are associated with any harms to the mask wearer.
Simple answer. That's good. Yeah, I think that's something that people fear, is that their child will start wearing a mask and they'll have maybe difficulty breathing or an increase of CO2, which we talked a lot about, which I know is there's no proof of that actually being the case.
The bigger, but again, to be fair and to acknowledge that it is not normal for youth, for adults. This is not what we normally do, and to say that it's nothing, I do think kind of minimizes the sacrifice that people make by wearing it. I think for young children, one of the really important considerations, though, is the loss of the ability to read nonverbal cues. So a traditional face covering you can't see through. And in a learning environment, that's a legitimate concern, how teachers and students interact using nonverbal cues. And I think we're all realizing in our kind of day-to-day lives when we're using face coverings that the inability to see facial expression, to see that smile or that frown or that facial expression is a change, and it's different. And how that is, there's no way that that's a positive in a learning environment. It's for that reason that there's been ongoing conversation about the use of face shields, which a lot of folks have probably seen. They're plastic face coverings. They sort of circumnavigate your forehead, and they're clear and you can see through, and they provide pretty good protection. The amount of evidence about their protection relative to masks is limited, but it stands to reason that it's a barrier that's in place between people, that it would block a large percentage of respiratory droplets. So there are a lot of conversations going on about the the use of face shields, especially for younger children, in some contexts, at perhaps during certain times of the day in learning environments like school, where nonverbal forms of communication might be considered extremely important. So this is something that is to be determined. So if you ask me, what's the most significant negative about face coverings for children in a school environment? It's not a risk of CO2 retention or some other kind of health harm. It's the concern about loss of nonverbal forms of communication.
So along those same lines too, how could a parent help ease a child's concern around wearing a mask, and how can a parent help a child get used to this idea of having something and explaining? Maybe you might not see those verbal cues, but you can always ask your teacher, how are you feeling, or something to that effect. How is a parent to kind of help a child say, okay, your school situation is going to be very different for the next year or so. I would like to help you. This is what I can do. Emily, do you want to take that one?
Sure. I think there's a lot of things that parents can do to ease kids' fears. I think, modeling, number one, and practice. I think we shouldn't expect kids to go to school on day one, never having put on a mask before, and suddenly being asked to wear it all day long. So I think we could practice at home. I think even, I've heard anecdotes of some kids, even with learning disabilities or autism or things like that, just being able to do that after some practice at home. And so I think that's the first thing that I would suggest that parents do before school starts is practice. A couple other things, speaking to them about their fears, like what are they afraid of, and trying to allay their fears, like, no, this isn't going to hurt you. This is not dangerous. Everyone else is going to be wearing a mask too. A lot of places I've seen, have a spare, you should have a spare mask with you in case something happens to it, that sort of thing. And that the rules will be explicitly laid out, and try to explain whatever your particular school is doing and what activities that the mask wearing relates to in those activities, and when you can take it off if there's any times or things like that, just so the kids really understand what's going to be going on with that mask.
Along those same lines too, if my child has a complex medical condition, or if my child lives with a high-risk adult, if I'm that high-risk adult, do you have any advice on what they should be doing versus in-person versus online school, wearing a mask versus non-wearing a mask? Adam, do you want to start with that one?
Yeah, that's one of the most challenging areas of in sort of pediatrics / school reopening. This is an area where the right answer is different for every child and family. So if you use, for example, the circumstance where a child, him or herself, has an underlying medical condition or conditions that might predispose them to a higher possibility of experiencing complications if they were to become infected with COVID-19. That's an individualized decision. That child and their caregivers are going to have to look at the school that a child attends. In that circumstance, they might want to. They might be more likely to attend in person if that were an option at their school, a school that had smaller class sizes, if that were available to them. It's possible that there could be additional accommodations made for a child who wished to attend in person, but in whom, for instance, the traditional classroom might have challenges in terms of physical distancing. Obviously, the mitigation strategy of mask wearing is really not an area for discussion because it's required for all children. It's possible that in that situation, one might consider attending school in person less often than their peers, maybe just enough to get some of the social and emotional benefits of in-person learning, but perhaps less often to reduce the risk. They might choose to make additional changes in their schedule, such as we were talking about before about dining in a cafeteria. That might be an area where in that situation, you might choose not to eat in the cafeteria, and the school may be able to provide an opportunity for that child to eat their lunch or have a snack in an environment where there's more distancing between individuals with masks. And lastly, in some situations, whether it's a child with a high-risk medical condition or a family member who lives in the home with that child who's at higher risk for serious complications, they may simply choose to participate in an online-only curriculum, which again is not ideal for most children, but that may be the right decision for that child. It's really a conversation between the child, their caregivers, and their pediatrician. And these are hard, difficult conversations.
Emily, any additional thoughts on that as well before we wrap up? And I'll let you two kind of wrap up with some closing statements.
Oh, I completely agree with Adam. I think that every family scenario needs to be considered because everyone's a little bit different. And I've been saying this for months now because people come at me with all kinds of scenarios. Well, what should I do about this or that or the other thing when this person is immunocompromised? Or so I really think, make yourselves aware of what's really going to happen in the school, really familiarize yourself with the plan, and then talk with the school leaders and talk with your providers, whether, especially if your child is at high risk, the subspecialist is probably the one to speak with, as well as the pediatricians, and really make that the best plan for yourselves.
Emily, do you want to give any closing just thoughts on the topic of schools and opening up, just any last words? And then Adam, I'll have you end as well.
Yeah, I think that nobody knows the answer here. I think that there are a lot of things that everyone's taking into consideration, and is this safe? But I think that there's honestly not a great solution on either way here. And so we've got to move forward with the best data that we have. And everyone's got to make their own decision on a personal level as to what's best for their family.
And Adam, what about you?
Yeah, a couple of big picture comments. Schools were the first thing to close and are looking like they're going to be one of the last things to open, and that's completely opposite of how it should be, and hopefully that can change. I think it's also really important to acknowledge that I think youth worldwide of this country and youth worldwide have sacrificed in a lot of ways more than any other group individually, in the sense that they're least affected by this virus, and yet they've made some of the most sacrifices with the interruptions to kind of their daily job, which is going to school. So I just want to urge our community to not just think about what do the schools need to do in the school environment, because the school environments are gonna do great. They are gonna do all of the right things in terms of mitigation strategies. I just want to urge everyone to, outside of school, continue to practice social and physical distancing, to wear face coverings in public settings at all times, in order to allow us to get children back to school. Because really, more than anything, it's what we do outside of the school environment that is going to make it most likely for children to return to school safely.
That's a perfect place to end. You bring up a great point, whether you're a teacher in the school, a child in the school, a parent, that it really will depend on what you're doing outside of that school situation to hopefully get us back to what the normal of school was back in like August of last year. So hopefully we start to see that come to effect, and it'll be interesting to see what happens in the next couple of weeks. I know that we talked before we started this live about keeping this type of series going, and there's tons of questions we weren't able to get to on the Facebook Live. So if we didn't get to your question, we will either answer them offline or in another Facebook Live coming up. I just want to give a quick couple of resources for you guys. We do have our blog network on intermountainhealthcare.org. We'll be putting up some safety content around opening up for schools that you can reference, when you should wash your mask, how often you should be replacing them, things like that. We also have our COVID-19 hotline that you can call to get screened or tested for COVID-19. That phone number is 844-442-5224. Please make sure you check testing hours before you head to location, just so that you're aware of when they're actually open. And Emily and Adam, thank you so much for joining us today, and we look forward to our next conversation.